My name's Karl Janich. I'm a neurosurgeon at IU Health. I've been here for about a year. We have a community neurosurgery practice. Most of what we see is degenerative spine disorders that often involve surgeries, and also we take care of a lot of the non-surgical management as well. I'd say the split is about 80% spine, 20% brain. Well, there's two big avenues for referrals for us. One's from the primary care doctors, and then the other route tends to be through the ER if there's any sort of trauma or people have shown up to the ER and they need a neurosurgeon for their particular problem, then we see them too. We ask a lot of questions up front to see what non-surgical management strategies have already been tried. You try to maximize all of their non-surgical options. The big one is going to be physical therapy. Normally we give people a certain set of time in physical therapy. There are back injections that can be done, medications that can be tried. You also have to make sure that if someone is a surgical candidate, that you minimize their risk for surgery as much as possible. So sometimes a lot of the time before surgery is spent managing risk factors. I was a paramedic a long time ago, a full-time paramedic, and it was the neurotrauma that seemed to be the most interesting to me. Then I went to medical school and I found out that a lot of the neurosurgery patients actually got a whole lot better than I thought they would. Because you hear horror stories about spine fusions back in the 2000s where they would fuse people for back pain, only create more back pain as a result. So seeing that neurosurgery was advancing to a place where it was actually helping people was a great thing to see in med school, and actually convinced me to go into residency. In residency, you start learning all the techniques and start seeing where the pitfalls are, where you can get what's a good idea to do, what's a bad idea to do, and then actually getting to implement that and seeing people getting better by my hands. It's really gratifying.